It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
All right, our first guest is Dr. Scott Greenspahn, a primary care physician with interest in disease prevention and opioid addiction. He can be reached at cohomedical.com. Opioid addiction, Shannon, huge problem in this country. And with a lot of people going into the dark days of fall and winter and with the pandemic, a lot of people are at risk for this kind of behavior.
Oh, absolutely, Tom. We talked about one long day since March, and COVID fatigue is real, anxiety, stress, and when that happens, a lot of people will turn to opioids, and maybe they're in recovery. And I heard the other day, I read something the other day that 30% of the folks that are in recovery have relapsed, either opioids or some kind of addicted alcohol or whatever it might be. But it's a real issue, and this is what Dr. Greenspahn works on: is helping people get off opioids, which are very addictive.
All right, let's listen to Dr. Scott Greenspahn and Shannon O'Kelly.
Welcome to Health Talk, and thank you for taking time to join us. Hey, listen, just describe your practice to our listeners. How would you describe what you do, your interest in your practice, and the type of patients you see? Maybe give us a little background.
Sure. I have been a hospital doc, board certified in internal medicine for years, and eventually switched and opened up my own primary care practice. Essentially, it's a combination of general insurance patients, traditional insurance model. We also do direct primary care. And then about an additional third of my practice is helping with opioid addiction using medication-assisted therapy.
Alternative resources to opioid addiction is what we're going to talk about. I like that the fact that I think I read your bio and your information, and you talked about embracing changed primary care because of his interest in, or your interest in, prevention of the disease, and his belief that medical costs can be reduced with careful attention to the patient's healthcare needs. I really like that. So you're looking at the whole person from medical standpoint, psychological standpoint, living, wellness, prevention. Is that how you kind of look at the person, your patient?
Yeah, and also having been an inpatient hospital doc for a long time, the real goal is, with pretty good regular care, keeping people out of an expensive hospital stay.
Well, maybe our listeners need to know what that means when you talk about being a hospital physician or a hospitalist, I guess they call it in today's world. What was that role?
So that role is essentially, if you've gone to the emergency room and the emergency room physician doesn't feel that you're well enough to go home, you get met by a doctor like me who comes down, takes the story, figures out what to do, admits you to the hospital, treats you, calls any consultants, does whatever medications or procedures are necessary. And then when we get you better, come up with a plan to discharge you home safely.
I can imagine that must have been a fantastic experience. To see various diagnoses, various patients. You must have had some great experience. That probably has translated really well into the private practice arena.
Yeah, I've seen essentially every single thing you could see in a hospital, and it makes it easy. And honestly, the nice thing is trying to finally prevent these things from happening rather than treating the heart attack after the person has come in is a lot more satisfying, to tell you the truth.
You and I both know that if you can prevent and intervene early before that heart attack, diabetes, obesity, etc., is very important. Particularly in today's world. Let's talk about today's world. We are right smack dab in the middle of a pandemic. We know that people that have underlying comorbidities, obesity, diabetes, cardiac problems, high blood pressure, are more susceptible to a more severe case if they do get COVID. That's a fact. Also, we know that in today's world, the anxiety, depression, concern, et cetera, et cetera. I think I read the other day that there's a 30% increase in people relapsing, using alcohol, drugs, et cetera, et cetera. This has been a challenging time for both the anatomy and psychology of the human body. So tell us about what you're experiencing and what you're seeing.
Well, since March and the beginning of all of this, we saw a sharp rise in demand for depression visits, anxiety visits. People were drinking too much. Extreme amounts of excess alcohol use have gone on for the last 6 months. We've seen numerous patients that actually graduated from our opioid program having problems and needing to get back on treatment to make sure that they stayed off the illegal substances. And it's been a very hard time, honestly, for tons and tons of people. The stress of at-home schooling with no work is not easy for the majority of humans.
More with Dr. Scott Greenspahn and Shannon O'Kelly next on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
We continue our conversation with Dr. Scott Greenspahn and Shannon O'Kelly.
Dr. Greenspahn, again, thank you so much for taking time to join us and talking about a very important situation and condition for folks out there experiencing anxiety, depression. You just mentioned that your practice has seen an increased people coming in for those issues or concerns. And also you mentioned that people in your opioid program are basically relapsing just because of the stress and anxiety. That's real stuff. And you're here to help. How do you help, and what is your model?
We bring people in that have issues with opioid dependency, and they've been addicted to these medicines for all sorts of reasons, whether they've gotten it off the street, off of friends, had problems after surgeries with doctors. We listen to their story, we find out what they've been doing, and we tend to use buprenorphine-containing products to help stop the cravings, reduce the withdrawal symptoms, and eventually get the cravings and dependency kind of muted in the brain. Once we've done that for several months, we try to taper people off. And in the program here, we get them involved with counseling, meetings, and try to get them back on the right track.
Why is it such a powerful addiction? We just see it so much in the media. This addiction has no religion, race. It affects everybody.
The newer drugs are even stronger. They're on the street. People get addicted to these things with very few attempts. They don't even know that they're feeling sick because they are dependent on the medicine. And soon the brain starts craving the drug over and over, and finding a way to turn that craving off with a medicine that makes you not think about this is a very important tool.
Okay, why is it so hard? I mean, I think I know the answer, but people need to ask for help. Particularly, we have to be comfortable. I think our society kind of relates asking for help to weakness. I don't know. It just seems like people need to ask for help because help is there for them, particularly like someone like yourself, a physician that is looking at the whole body and trying to take care and move people into a healthy lifestyle. Why is it so hard for people to ask for help?
There's a lot of stigma associated with this. There's a lot of embarrassment associated with getting yourself into this situation. And you got to find a nice clinic where people do not care whatever the reason was that got you into your difficult situation, and that we're just there to help get you out. This is a difficult thing to do on your own. People have been going to doctors and asking for medicines, even though they knew they were doing the wrong thing, and they felt bad about it. And this is a good way to get back on track in a legal fashion.
As we wrap up, give me a summary. It's a huge topic in a short period of time. What do we need to know? What does the public need to know? What kind of message can you leave everybody with as we close this segment?
I think the most important thing is if you have a problem with dependency on narcotics, you can search for medication-assisted therapy. There are many clinics outside of my own that are also helping out there. There are websites that can help you find sources to find doctors that are out there. You can really get help pretty easily nowadays.
The key word there is you can get help these days. Reach out, look for help. We can all do this together. Thank you, Dr. Greenspahn. Great information.
Appreciate it. Take care.
Well, Shannon, we were talking to Dr. Scott Greenspahn about opioid addiction. There are alternatives, and one of them is physical therapy to help relieve pain.
Absolutely. That's what the majority of people, almost 100% of the people that seek out physical therapy are seeking it out because of pain. Pain is the root cause of people asking or wanting to come to physical therapy. And our intervention in physical therapy that's our focus.
All right. We continue right after this time out on Como.